Hi, my name is Tori, and I work in the allergy department here at the Ear, Nose, and Throat Institute. And I'm here to talk to you a little bit today about Allergies, our program. And let me start with a little introduction. Like I said, my name is Tori. I have 15 years in the allergy space. I'm in the medical field. Prior to that, I have an education in environmental sciences and horticulture. So I know a little bit about trees and molds and what's going on in the environment. So I can speak to you about why you should get tested for allergies. We live in Georgia, so we have a high pollen count in the spring, but we also have a lot of molds that come out in the fall and in the winter months that affect patients that we see and affect the people that come to us for treatment and to identify what's going on with them. So the reason to get tested would be that you have recurring sinus infections, that you have ringing in your ears, that you have even balance issues can be directly related to allergies and what's going on in the environment. At the ENT Institute, we test for the most common allergens found in Georgia, and that includes trees, grasses, ragweed. It's really bad in the fall, environmental molds, like I said, and dust mites, dogs, cats. Basically everything you find in Georgia. Of course, these items are in other parts of the country as well, but we test for the most common in the Southeast region. So oak trees, maple trees, all of the goldenrod, many different weeds that can affect patients in a negative way. One of the ways you would know if you need to be tested is if you have a tendency to lean towards allergy medication. So Zyrtec, Claritin, Allegra are very common allergy medications that are taken. The problem with that is it never really is going to do anything to what's causing the negative symptoms, okay? So it's only going to treat your symptoms. It's not going to treat the cause. When we can identify what you're allergic to, the first line of defense is going to probably be avoidance. Well, it's very difficult to avoid going outside. It's very difficult to avoid dust if you're allergic to it. If you find dust in your homes, you can try to navigate through that. It's very expensive and it's also very difficult. There's dust in our cell phone cases, and how did it get there, right? So understanding that it's very hard to avoid, the easiest way to deal with that is to talk about some treatment options. So treatment can be many different things for different people. The most effective treatment, however, is going to be allergy immunotherapy. So what allergy immunotherapy does is it doesn't make you unallergic. What it does is it trains your body to respond differently to the things that you're allergic to by helping your body naturally create antibodies. We use your body's own natural defense system to create those antibodies in a very slow and steady manner so that when you come in contact with those items in the future, your body doesn't respond negatively. You don't get those sinus infections every spring. You don't get bronchitis every fall. Those are issues that happen seasonally, and when you're exposed to them seasonally is when you have your body responds over the top, if you will, and that's when it sends out in the soldiers to help combat the invader. So that's why we get infections, and that's when the body is just overwhelmed by what it's allergic to. So back to some treatment options. Medication's never going to treat the cause. It's only going to treat the symptoms. And a lot of our patients find that they have to change medications often. So they may be on Zyrtec and that stops working for them. They become tolerant to it. They move to Allegra. They move to Zysol. They move to nasal sprays. All of these different medications are driven towards allergy sufferers. But again, they don't treat the cause. They're only going to treat the symptoms. They're going to give you some immediate relief, but they won't be long-term. So back to allergy immunotherapy and helping your body naturally overcome what it's allergic to. It is been in play for over 150 years. It is what is the recommended gold standard for allergy sufferers, and it really works. So that being said, you don't have to be on it forever. Hopefully you're going to see that reduction in symptoms quickly by following our program. And our program is slow and steady wins the race, okay? So at the ENT Institute, we support our patients through their treatment journey by making sure that they get what they need, that they're encouraged and supported throughout the treatment process. Most patients can expect to be on immunotherapy anywhere from 1, 2, but possibly even 5 years. It really just depends on how well the body responds to the treatment. If they're compliant, which also means that they're dedicated, it does take time to retrain your body to do something differently. Just like it does to train yourself to drink more water, just like it does to train yourself to exercise. Watch your diet. It is a regimen that can be, that requires you to be diligent to get the results you're looking for. So those expectations are easily managed here at the ENT Institute because we understand what you're going through because most of us have done it. Those of us that suffer from allergies, myself included, I came from California. I did not expect to see pollen on the ground when I moved to Georgia. I did not expect to have these allergy problems because I had not had them previously. Now, that's not to say that you don't develop allergies in your home state, because you absolutely do. Your allergies are directly related to your immune system. So if your immune system is busy doing other things, aging process, keeping you healthy, keeping you well, you may be more susceptible to developing allergies in the future. You may have not had them as a child, but then as you get older, you start to have more allergy symptoms and they start to become worse, or vice versa. You may have had them as a child, had allergy shots, gotten better, and then as a young adult, not really suffered. And then as you later in life, they start to come back in on again, and you start to have those negative reactions. During the treatment process, you may experience more symptoms, but that's a temporary thing. The idea is to get through the hard times, and we can help with that. Once you get past that and your body is moving in the right direction and you're having a reduction in symptoms, and you notice that you don't get a sinus infection every March, that's positive. That means the treatment's working. That means you need to stay true to the regimen. How we do it is you're going to start the first year with an escalation phase. During that escalation phase, it's just exactly that. We're going to escalate you through the treatment process. We're going to start you at a very weakened dose so that your body doesn't overreact to what we're introducing it to. And slow and steady, your body will build antibodies to what you're allergic to. And again, this is an all-natural treatment option. There is no medication. It's a serum created specifically for you, for your treatment regimen. During the escalation process, we escalate you through a series of vials that will be stronger every time you move to the next vial, okay? So basically, we're building the foundation of a house. We're going to build the walls. We're going to make it strong. Once we get to that finish of the escalation phase, we're going to put you on a maintenance round. So maintenance basically just puts a roof on the house, okay? We're going to make sure that that foundation is strong enough to hold that roof up, and then we're going to maintain you at that strength until we are determining that your symptoms have been reduced in a manner that you can now go mow your lawn. You can now garden in the yard. You can now take that trip. You don't notice that your car's yellow. You don't notice that you are not taking as much allergy medication. You're not noticing that you're rolling your windows up when you're seeing anybody blowing with a blower after they've mowed grass. These are things that your subconscious will do to protect you from things that you're allergic to that we don't even recognize that we're doing, okay? We won't go outside or go to the park or do things that our body knows is going to have a negative reaction. But with allergy immunotherapy, those days are over, okay? Some people think that if they're allergic to dogs and cats, that they can't have pets. But that's not the case. Allergy immunotherapy can help you with that. If you have dogs that are marketed as hypoallergenic, you may have a less reaction to the dog's fur. However, if you take that dog outside and they bring in all that pollen and all those mold spores into your home, that's probably what you're reacting to as well. So don't set yourself up to think that you have to live a certain way. That's not the case. We're here to help. So why should you choose the Ear, Nose, and Throat Institute? Well, like I said, I've done this for about 15 years, and I've been with the Ear, Nose, and Throat Institute, and I found a home. I believe in what we do here, and I believe that we are here for our patients. I've worked in a few other medical practices, and no one has the heart and the soul that the Ear, Nose, and Throat Institute has for its patients and for the community. But more importantly, our patients. We have all sorts of options for patients to get better, feel better, take care of your family, just like we do our own. We have our physical therapy department. They're great with our balanced patients. Patients that are suffering through allergies, that have balance issues, dizziness. When you have allergies, your body responds in many different ways, not just those symptoms we see on TV, where you get itchy, sneezing, watery eyes. Don't think that if you could run through a field of dandelion seeds that you're okay. That's what they tell us on TV, okay? So that's not necessarily the truth for every patient. Some patients have skin issues. Some patients have dizziness. Some patients have ringing in their ears. Some patients have chronic ear infections. They have sore throats due to the pollen them inhaling the pollen. It comes in through your nose, down your throat, and causes throat issues. All of these are a direct result of allergy symptoms. And what we can do is treat all of those things to get you feeling better sooner and get you on the road to recovery faster and bring back that quality of life. That quality of life that we all missed during COVID when we couldn't go outside, right? We longed for that. So let's not let your allergies keep you from enjoying your life, from enjoying your pets, from enjoying your vacations, from enjoying all of the things that we hold dear. That's why you should choose the Ear, Nose, and Throat Institute, because we truly care about all of those things about you and in your life. So in closing, my name again is Tori. I'm so happy to have been able to share some information with you about the whys, the hows, and the us's. So I look forward to seeing you soon. Please come see us, let us help you, and let our family take care of yours.